So James, what do you think physical therapy is?
So I believe is a massage.
I would define physical therapy as almost like a hands-on physical medicine, kind of like you just work your body to get back in shape from an injury that you previously had, or maybe like sore muscles or something like that.
Well, I believe it's when a therapist will massage your sore muscles.
Like rehab for your body.
Great question. Physical therapy is a whole set of treatments for folks who are having injuries with their muscles, skeletal systems, sometimes their neurology. So physical therapy usually involves massage, acupuncture, stretching. Those are the usual interventions, and usually doctors or trainers involve themselves with that. Ice is one of the most important ingredients as well.
Maybe healing from an injury.
Physical therapy is when someone who has problems goes to a person for help.
So I think physical therapy is whenever someone has a problem going on in their body and needs to heal. To help that, they go see a specialist and they help them recover.
Physical therapy was like made in the early 1900s. I think it's like a rehab when someone gets hurt. Basically, they have a trainer work with them and try to get them back to their former status.
So AJ, have you ever been through physical therapy before?
Yes, I actually have. One time last year, I had a strained ACL and a torn paternal disc in my knee. So I had to go through physical therapy for about 3 months and basically just worked out my knee and stuff till it got better.
Was it helpful?
Yeah, it was really helpful. It helped me get back probably quicker than I would have if I just kind of sat around and let it rest.
No, I have not, but I've had many sports injuries and had to go to the trainers for rehabilitation and stuff like that, and I know my brother's done it a lot of times.
Well, it really helped me get my range of motion back, and it really allowed me to be able to lift weights and perform sports back at the level I was a few months prior.
What's it like owning your own physical therapy place?
Yeah, first of all, it's a lot of fun, but it's a lot of hard work.
Why did you decide to enter the physical therapy field?
No, actually I went to a physical therapist when I was growing up, and it helped a lot, and it seemed like something interesting, and kind of wanted to be in the medical field, and so physical therapy seemed like a reasonable option.
Mm-hmm.
There weren't a lot of people doing it at the time. And so I kind of, decided clear back when I was in junior high school it's something I would pursue. And I'm glad I did. I would do it all again. I came from an athletic family, right? I know that.
Mm-hmm.
And so it happened to me in junior high school kind of during, the peak of my athletic career. It was frustrating because, I was raised by a mother and a father. Father was, you talked with him, a former All-American, and precluded me from participating in athletics, which was a painful thing for me. So that's kind of why I pursued it.
What age range do you usually treat?
So I treat, anywhere from youngest is probably 12 years old, 13 years old, on up to, more geriatric people. I deal in sports medicine, mostly orthopedic kinds of things. I see mostly knees, shoulders. I do a lot of overuse kind of soft tissue injuries, treat a lot of runners, cyclists, and those kinds of things. And that could be anywhere from, a highly competitive athlete to, a 70-year-old who enjoys playing golf or who bike rides. And we see a lot of those people here, people who ski and are older, but mostly people who are active and want to lead an active, vital lifestyle is what I work with. I've worked with Olympic athletes, really high-level people, people who've gone on to play in the NFL and those kinds of things as well. So kind of the gamut, but mostly people who lead an active lifestyle and want to continue to do that.
Do you use dry needling?
No, I don't, but we will be.
When do you plan to use it in your system?
We'll probably implement it within the next year and a half, something like that. We've got some other priorities right now that are ahead of it, so we're working on those, really.
And have you ever done it yourself?
I mean, like, been a patient and had it done?
Or had it done, or got to do it to someone?
I've gotten to do it to somebody, and I've had it done.
How would you explain the experience of getting dry needled yourself?
I'd say it was a semi-effective, a little bit painful, but nothing bad. Yeah.
Did it help?
Semi-effective and a little bit painful. Yeah, it helped a little.
Okay.
It only helped for a little while.
Okay. That's the trick with dry needling. It's supposed to help for a short period of time, but it does help you.
Correct.
In the state of Utah, physical therapists can't use needles. But we use, again, depending on what it is, a lot of overused stuff. We use A-stem and grafts-on techniques. I don't know if you're familiar with those things or not, in conjunction with exercise. And we do a lot of kinesiotaping. And I'm kind of exercise-oriented, manual therapy some, and that sort of stuff. It really helped loosen really helped loosen me up, and for even when I wasn't all the way healed, doing it before a game really helped me loosen up for a day or two, and then I would have to go back the following days and do my therapy to get back to where I was. But for a short span, that really helped me be extremely more flexible.
When do you think that Utah will pass the law to allow physical therapists to be able to use dry needling in their techniques?
I don't know. I haven't been involved in that discussion at all. And I don't even know if it's come up. I think there are lots of other things that will help us be effective, and that can help us be effective in treating patients.
How does aquatic therapy help a patient?
Okay. Aquatic therapy helps patients by allowing them to achieve their goals in a gravity-reduced situation that they might not otherwise be able to achieve on dry land where gravity is not reduced.
How would you define PRI?
As extremely advanced biomechanics and human kinetics.
In an elementary way, what's another way of saying that?
An extremely advanced understanding of how human bodies move.
Are there any unethical or illegal practices going on in physical therapy right now?
There are physical therapists who will allow themselves to be owned by a physician. What that does is if the physician owns the physical therapist, what that means is the physician will overutilize the physical therapist services, because what's happening is he's getting money for referring to that physical therapist. And it's against the bylaws of the APTA for physical therapists to enter into those agreements. But the bylaws are weak, and there's a federal law called the Stark Law that doesn't allow it either. But the Stark Law is weak. So physicians do it anyway, and physical therapists do it anyway. The benefit to the physical therapist is that they get a higher starting salary. The benefit to the physician is they get kickbacks for every patient that they refer to the physical therapist. And it happens all the time, and it's going on right now.